Where you live should never determine if you live. It's such a simple idea, but for billions of people, it's just not the reality. Here at Elysi, we're going to break down one of the world's most critical and solvable health challenges, getting essential medicines to everyone. We're going to walk you through a powerful blueprint for how we can make sure every single person, everywhere, gets the treatment they need.
Let's start with a number, 2 billion. Just let that sink in for a second. That's more than 1 out of every 4 people on Earth who don't have regular access to the medicines they need to stay healthy. This isn't just a statistic. It's a massive injustice that we absolutely have the power to fix.
And that's the most important part. This is not some impossible dream. The gap is preventable. The deaths are avoidable. And we already have so many of the solutions. Really, the challenge isn't a lack of know-how. It's about putting that knowledge into action. So let's look at the plan to close this gap for good.
Okay, so here's our game plan. First, we'll get a handle on the crisis itself. Then, we'll dive right into a detailed 6-point action plan. After that, we'll talk about how you can get involved. And finally, we'll give a shout out to some of the amazing organizations already leading this fight.
So to build a better system, we first have to really understand why the one we have now is falling short. What are the biggest roadblocks standing between a person who's sick and the medicine that could save their life?
Well, the barriers are pretty systemic. You've got prices that are kept artificially high because of monopolies. You have supply chains that are so fragile that shelves are empty even when the medicine exists somewhere. The basic infrastructure just isn't there in a lot of places. And then you have affordable generic medicines being held up by red tape. Each one of these is a major point of failure that we have to address.
Okay, so how do we start breaking down those barriers? That brings us to our blueprint for universal access. And this isn't just a wish list, it's a full-on strategy, based on evidence, designed to dismantle these problems piece by piece. Our plan is built on 6 pillars that all work together. Think of it like a complete toolkit, where each tool is designed for a specific problem in the system. We're talking about fixing prices, building factories locally, making distribution smarter, empowering communities, changing how we reward new discoveries, and then wrapping it all up in universal health coverage. Let's take a closer look at each one. All right, the first point is a real game changer. We need to shift from pricing for maximum profit to pricing for maximum health. What does that mean? It means we create a global standard where essential medicines are priced close to what they actually cost to make. It might sound radical, but we have some incredible proof that this approach really works. I mean, just look at this. This is what's possible. When generic competition was finally allowed for the early HIV/AIDS drugs, the price for a year of treatment absolutely plummeted, from $10,000 down to about $70,000. That's a 99% price drop. This isn't a theory. It actually happened. It shows you what's possible when access is the #1 priority.
Next up, we have to make our supply chains tougher. Having almost all production in just a handful of countries makes us incredibly vulnerable. The solution? Build manufacturing hubs locally and regionally. A fantastic example is the WHO's mRNA Tech Transfer Program. This builds self-sufficiency, creates jobs, and makes sure a country doesn't get cut off during the next global crisis. A lot of the time, the problem isn't that there's no medicine in a country, it's that it can't get from the warehouse to the local clinic. It's a logistics failure. By using modern tools like predictive analytics to guess demand, or even drones for urgent deliveries, we can solve that empty shelf problem for good.
And we can see the impact in the real world. In Zambia, when they put an integrated logistics model in place, clinic stockouts were slashed from nearly 50% all the way down to just 13%. That shows you how smart systems literally save lives, just by making sure the medicine is there when a patient shows up. We also have to bring the care directly to people. Trained community health workers? These people are the real heroes of public health. They're the ones who extend the reach of clinics right into people's homes. And the evidence is clear. Their work drastically reduces deaths from common killers like childhood pneumonia.
Okay, this next one is so important. We need new medicines, right? Innovation is absolutely critical, but the current model is kind of broken. It forces companies to charge sky-high prices to recover their research costs, which creates this whole access crisis in the first place. The solution is to de-link those two things. By using things like prize funds, we can reward companies for their amazing innovation directly. This frees them from having to rely on high prices, which means the medicine can be affordable from day one.
And finally, all of these pieces have to be anchored in the big goal: universal health coverage.
When essential medicines are just part of a country's health system, they become a right for every citizen, not a luxury item for those who can pay. It removes the financial barriers right at the point of care, and that is the final crucial step.
So that's the plan. But a plan is just a piece of paper without a movement to make it real. And this is where you come in. Because everyone, and I mean everyone, has a role to play.
If you're a professional in this field, a clinician, a scientist, a logistics expert, a policy researcher, your skills are so desperately needed. You can offer direct support. You can advise organizations on the ground. You can do the research that makes the case for change even stronger.
If you're an advocate, a student, or a community organizer, your voice is your superpower. Seriously. You can raise awareness, educate people around you, and talk to your elected officials to push for policies that put health first. Your participation is absolutely vital.
And for everyone, your support is critical. Whether it's through donations that fuel the amazing work already happening, or by volunteering your time and your skills, you can provide the resources that help this movement grow.
And the best news is you're not joining an empty room. There is already a powerful coalition of organizations doing incredible life-saving work. Let's just highlight a few of the many allies who are already leading the charge. I mean, the impact of these groups is just staggering. Gavi has helped immunize over 1 billion children. The Global Fund has saved 70 million lives. Doctors Without Borders, MSF, was a key force in that 99% price drop for HIV drugs we talked about. And DNDi is developing treatments for diseases that the market just forgot. These groups prove that massive global change is totally possible.
So when you see all this progress and all this potential, it kind of leads you to a big question, right? If we actually put all these pieces of the puzzle together, what does the future we're all fighting for really look like? What's the vision?
This is it. This is our shared vision. A world where essential medicines are priced near cost for everybody. Where local manufacturing means resilient supply chains. Where logistics are so smart that no clinic shelf is ever empty. Where innovation is driven by human need, not by sales figures. And where universal health coverage makes access to medicine a fundamental human right. This vision, it isn't a dream. It's an achievable reality, and together we can build it.